Why would a doctor need project management skills? You're being funny? You're being ridiculous? Is this some kind of joke? Surely there is a grand total of zero requirement for a doctor to have project management skills. Like, you are talking chalk and cheese here. What on earth could be related between these two things? Surely the patient comes in, see them, and either diagnose and treat them, or you diagnose and you're like, I'm not really sure what's going on. Let's get some tests. I'll see you back in a couple of days' time with the test and we'll work out what's going on. And then I'll treat you. And these are the two models that medicine has been based on for years. For years, this has been what happens. You go back to the early days of medicine and the patient came in, and either we could diagnose them and treat them, or diagnose them, send them for investigations, they come back, and then we treat them. And all of the software and all of the notes are designed around this. Remember that back in the day, you would have a card that notes would be written on, and you could look back over the card for sure, see what's happened in the past, but largely the type of medicine that used to exist was acute care, like an emergency appointment. You go to the emergency department, there's a problem, they sort it out, see you later. Now that's not happening anymore. And part of that is because general practice is no longer viable with how much the government pays. To bulk bill and to accept what the government pays, even with the new bulk billing legislation in the budget, it's still going to be pretty difficult. Why? Because everything, as you might have noticed, is getting a whole lot more expensive. Don't know why that would be, but yeah, if you shut the world down for 2 years, there's probably going to be some consequences. But getting back to project management, you see, what has changed is not only COVID and inflation, but also the complexity of medical conditions is significantly higher than it used to be. And most of these complex medical conditions are chronic, i.e. they don't get better. They get a bit better, they get a bit worse, they get a bit better, they get a bit worse, but they never get cured. They never get resolved. And this means that there's always things to be done. There's what needs to be done next week and next month and in 3 months and in a year. And whether that's referrals or testing or whatever aspect of care it is, that there's things that have been done in the past, there's things that are getting done now, and there's things that are getting done in the future. And you will see this in every referral letter that comes back, whether it's from the emergency department or a discharge summary or from a specialist or even from allied health professionals. Say, hey, this is what the plan is. In 2 weeks' time, do this. In 3 weeks' time, do this. In 6 months' time, do this. In 3 years' time, do this. Now, you can utilize the recall system for this. But the recall system is only telling you when things need to be done. And there's very limited ability to know the context of that. What else has happened during that time? Or where does that fit in the grand scheme of that patient's health? But project management handles this well. It's just not been a part of medicine for a very long time, i.e. never. Project management is for engineers or for building buildings or many other things in life, but not for medicine. But that has changed. that has changed, and the skill sets required for project management have not been taught. Not taught to medical students, not taught to doctors. Why? Because we didn't need it. But now we do. And project management for patients, even getting the concept that it's a requirement, that this is the problem that we are facing, that patients now have requirements for healthcare today, tomorrow, 1 week, 4 weeks, 6 months, whatever it is. And all of those things need to be tracked, as in when they need to be done, who's responsible for it, who's going to do it. Is it the cardiologist? Is it the allied health professional? Is it us as GPs? Who is it? Let alone the ability for everyone on the healthcare team, if we are heading to this fragmented and fractured model, which we are, that the pharmacist will be providing healthcare, but if they are going to do that in isolation, away from everything that needs to be done, then they are at risk of errors. They are at risk of doubling up, as we all are in healthcare. If I can't see what the cardiologist wanted, or the gastroenterologist wanted, or the emergency department planned for, or the hospital planned for, which I can't, or at least I can't without going deep diving into health records, of which there is a vast amount of irrelevant information in any particular circumstance. This makes it very hard. Makes it hard for all of us. And so things get done over and over. Things get missed. Things get done late. Things that should have been done get found 3 months later when there's a much bigger problem. There's a funny little saying, you might have heard it. A stitch in time saves 9. But if you don't do the stitch, then you are forced to do the 9. And in a world where inflation is going up and resources are becoming more and more scarce and the demand for healthcare is going up, if you're going to do 9 stitches every time because the one stitch got forgotten, missed, or otherwise didn't get completed, then this will mean our society suffers significantly more medical problems than it had to. So the question is, how are your project management skills? How's your understanding of project management software? Because most enterprises doing project management aren't using Excel. Some of them are. But most of them are using software because it's quicker, faster, easier, and better. How on earth would we even face this problem? Well, first of all, it's recognizing that we have a project management problem in healthcare, and then trying to work out how best to solve for that problem that works in the fragmented and dispersed healthcare that is the norm. Many patients don't have a regular GP. They have a regular practice, yes, but that patient will often see multiple GPs. Why? Because the GP goes on holiday. The GP's only working 2 days a week. Their GP is full. Yep, you can see the GP, but it's going to be 3 weeks. But I got a problem now. Great, we've got a spot with Dr. X. And they're like, yeah, I'll take it, because they need to be seen. So we need to sort this out. This is a significant problem. We don't need to sort it out. We don't need to sort it out. It just will drive healthcare costs through the roof at a time when we can ill afford to do so. So what to do? Well, first thing is to have a look at project management. How does it work? What's involved? There's some great books on project management out there. But considering how you manage what needs to be done in the future, how you can quickly reference what's already being done, how you can manage your patients better because they are no longer an acute problem, but rather we are dealing with chronic care, chronic complex care, chronic complex fragmented care. And I hope that you're beginning to understand that we are facing significant difficulties in medicine. And we haven't sorted them out. They ain't sorted. There's no way that this stuff is sorted. Not on any consistent level that plays out across the healthcare environment. So we've got some challenges, we've got some problems, we've got some opportunities here as well, which is really exciting. Because the level of healthcare that could be provided in Australia, with the level of doctors, nurses, receptionists, hospitals that we have an excellent healthcare system. But what we do not have is an excellent project management for health. We haven't even realized that this is the problem. This is the problem. We're using the wrong tools. Trying to dig a hole with a fork. It kind of works, but it's dangerous and exhausting and a little bit ridiculous. So have a think about your project management skills. Is it worth even considering that this is the problem, let alone the software that's required to allow multiple providers to log into a patient's file and see what's planned and what's being done? Health record? Yeah, sure. It just doesn't do this. I'm sorry. Health record is useful, but it is inadequate for what we are dealing with in this current environment. And it's only going to get worse. We've got more baby boomers, more healthcare demand. We've got many, many, many challenges. And we are inadequately prepared because we haven't even defined the problem in the first place. All right, so that's all I got for you. I'm going to go hang out with my family for a little bit. Just lit the fire. My kids are doing well today. I hope you are doing well as well. But think about the challenges that you face and whether the tools that you are using are designed for the challenges that you face. Chronic, complex, fragmented medical care is inadequately served by software and tools that are designed for acute care. All right, catch you next time. Thanks for tuning in. See you then.